Time now for News Extra here on KNEB 751, and we're at 34 degrees this morning. Our program is brought to you by First State Bank of Scottsbluff and Gering. I'm Dennis Ernest with the program this morning, and we welcome Dave Holmquist, who is president of Nebraska AARP, American Association of Retired Persons, if I got the alphabet soup right.
Although we now say RP is real possibilities. Retired persons.
There you go.
Good morning.
And welcome to the area. Welcome to KNEB. And you've been at the helm of AARP Nebraska now for what, half a year?
For about 6 months, yeah. I retired from my full-time employment September 16th and became state president the same day. So from the frying pan into the fire, or vice versa.
Well, AARP has a lot of clout. And what is your membership across Nebraska?
Across Nebraska, we have over 100,000 members.
Wow.
About 108,000 the last time I looked at those numbers. So.
And some active, some carry cards, and that's about it. I mean, it's...
Some are active, some carry cards, some are volunteers, some get active at the local political level, and by that I don't mean politics as we know it, but in terms of policy.
Yeah. And that's what we want to talk a little bit about today, several things of major concern to older Americans and AARP specifically. Let's start on the state level. We're getting into the home stretch of this 90-day session, and it's getting down to crunch time now for the senators to get something done.
It absolutely is.
And so what's of major concern there? I got to think the taxes, income tax proposal, the property tax proposal, or some sort of a balancing act that now is being touted as the answer.
Absolutely. We are opposing the governor's proposal for income tax cuts. We generally do support tax cuts. We have done that in the past, and we always look forward to doing so. We just think the timing is bad for an income tax cut, and we also understand that Nebraskans are more concerned about property taxes than they are about income taxes at this point. So we hope that the legislature and the governor can work out some sort of a compromise deal that will make the state budget sustainable. We know they're going to have to cut programs. That goes without saying. But we are facing a potential $1.18 billion shortfall by 2021. And our state revenues are not rising as rapidly as has been predicted.
Mm-hmm. So what sort of proposal would you say they need to take up, or what would you?
Well, we just think this isn't the time to cut income taxes, and we may not be able to cut property taxes at this point in time either. Let's wait until we're in a much better financial situation. I'm not sure that we have submitted a proposal. We simply are working with other organizations who think that this is bad timing for an income tax cut.
And as you said, that's almost a little difficult to say, because you'd love to see an income tax cut in this state.
Absolutely. The income tax proposal has been tied to a 3.5% revenue increase, and that hasn't happened very often over the past 15 years when we've been tracking those cuts. So it may not even go into effect if it's passed, but once we hit that threshold, then the cuts would begin. It's designed to be phased in over a number of years. We feel that number of years might be stretched from, let's say, 7 to 15. So that tax cut probably won't be appreciable to most people anyway. Let's find a more equitable way to treat it.
What other policies at the state level have the organization picked up on?
Our biggest state level policy over the past few years has been for caregivers. Last year we passed the Caregiver Act, and this is an act that allows more information for those caring for their loved ones. Let's say someone's released from the hospital and they're sent home and said, well, you need to take care of these wounds. Well, unless those caregivers are told how to take care of those wounds, it's tough to do so. So now hospitals and other medical centers in Nebraska who are releasing patients are instructed to and are happily agreeing to help caregivers learn how to care for their loved ones, because one of the problems has been hospital readmittances. And we're trying to do away with those kinds of unnecessary health care costs. So being caregivers is something we may all face. We have the people in the sandwich generation who are caring for their parents and their children. Caregiving is a big burden, and we're trying to find ways to make caregiving more manageable for people.
Mm-hmm. Important topic. Let's turn to the federal government, but let's take a break, shall we, first, Dave, and then we'll be right back.
Hey, Nebraska, Dave Ramsey here. When I get asked where you should keep your money, for me it's a no-brainer. Locally owned community banks like First State Bank in Scottsbluff and Gering. They offer all the bells and whistles of the big banks, but with free checking that includes free e-statements, free online banking, and no-charge First mobile banking, free ATM transactions nationwide, and no monthly maintenance fees. First State Bank, Scottsbluff and Gering. Member FDIC.
On the News Extra program with Dave Holmquist, Nebraska AARP. Dave, are you doing any local programs or get-togethers with folks here?
We're having a meeting today. We have what's called the CAT meeting, and this is a AARP RAN meeting, so it's the AARP Regional Action Network. And we meet out here 3 times a year. We meet here in April, July, October. Those are ballpark dates. Mm-hmm. We have about 35 very active volunteers who meet to report to us and to one another what activities they're involved in the Scottsbluff, Gering, and Panhandle communities.
Okay, very good. Let's touch on some federal issues. There's a lot going on there.
There's a lot going on.
It's a lot to be concerned with.
It's been a very interesting year so far, and we expect that it will continue to be so. We're very concerned about Medicare and making sure that Medicare stays strong for seniors and those who will be needing Medicare over the next number of years. We want to make sure that they don't cut Medicare benefits to senior citizens. After all of us have paid into the Medicare over the years. Often it's referred to as an entitlement program. I think when we're paying into a program, as we would an insurance package, we expect to have those funds available for us in the future. So it's not an entitlement. It is simply an American savings plan for health care, if you will.
The American or Federal Health Care Act, I don't even remember the name of it now, Affordable Health Care Act, I think everyone would agree that it needs some work, at
Absolutely.
least, if not a total
No
rework.
question.
And where do you come in on that? And I know that proposal failed and may or may not come back up soon.
Well, what the rumors we're hearing right now is that they're discussing it in the Congress, particularly in the House of Representatives, and trying to find a compromise that will suit the very conservative bloc and also the moderate bloc to come together to get enough votes to eliminate the current Affordable Care Act and come up with something new. We have real concerns that they might do away with the pre-existing conditions exclusion. Anybody who's ever suffered from cancer or any other major chronic disease knows that getting insurance after having a chronic disease is nigh on to impossible. We want to make sure that is not an issue that gets off the table. We would like to see some accountability for the high cost of pharmaceuticals. Those are getting to be outrageous for people. We think there needs to be a slow and steady look at what's going to be best, and then let's pass something that's the best for all Americans.
All right, very good. We're going to have to leave it at that, but we appreciate your coming by. Dave Holmquist with AARP Nebraska.
Thank you for the opportunity.